First of all, thank you very much for having the opportunity to be here. Obviously, I'm talking, as Marco already said, about cannabis today. And you might be surprised about this title, Leveraging Cannabis for a Better Society, because most of the people still have something negative in their mind when they think about cannabis. And the thing is, that brings you straight to the problem that I want to talk about. And this is that our perception of cannabis is distorted. What many people don't know is that cannabis, by the way, similar to the native ingredient of aspirin, was for 3,000 years already used in many different countries as a pharmaceutical. Like the old Chinese already used cannabis to treat pain. In old Egypt, there are documentations about people using cannabis. So it is basically something that was used for a much longer time as something good for the people. And only in 1940, cannabis was basically illegal or became illegal. And before that, even my grandmother in what's now Western Poland could buy cannabis in pharmacies in 1920, 1930 without any problem. However, what happened is that at some point, written or led by the US government, it was decided that cannabis should turn illegal. And then obviously the reputation of cannabis as a pharmaceutical or as something that can do good for the society rapidly declined. And since that start of what we call prohibition, the problem is that basically cannabis was not really seen as something positive anymore. And the other problem is that this also led to the fact that no one did research anymore. So while most of the other drugs that we use today, like pharmaceuticals, to treat our problems, the main research was done in between 1950 and 1980, and that was exactly the time when cannabis was not able to research because it was classified as an illegal drug, and by the UN, it still is. However, what we often forget, or what we don't see, is that cannabis has a huge potential. Already in the 1990s, like Israel already started to reinvestigate the potential of cannabis, and there they suddenly found out that basically there's a lot of potential in the plant. It can actually include up to 300 active ingredients, cannabinoids, terpenes, flavonoids, that all are modulating your body in different ways. And that's the reason why you see in research today, very young research, but very promising results in fields like ADHD, chronic insomnia, appetite loss, pain management, inflammation. And what we see as well is that also, cannabis was always seen as a very dangerous drug. And if I ask my grandmother, she still thinks that you take cannabis with a syringe. It is something that was hugely overstated in the past in terms of risk. So if you look at the official World Health Organization charts right now about how harmful drugs are, number one is alcohol, then there's a few others, then there's tobacco, then there's a long time nothing, and only then comes cannabis. So obviously, within the last 15 years, a lot has changed, but still also a lot needs to change going forward because cannabis and the stigmatization around cannabis is still not where it should be. But there we come into play because we already in 2018 saw that there is a potential in this plant and a potential that not many people see, but something that we saw. And that's the reason why we created the Sanity group. And originally we thought about what can we do as a company to basically leverage the potential of cannabis in society. And the first thing that we did was pharmaceuticals. We have 3 brands here. Biomed and Avai already selling and marketing innovative cannabis products today. So it can be not very innovative flowers, but it can also be product innovations like, for example, suppositories or nose spray or other forms of dosage that actually you can use to do something better than just smoking cannabis, which Marco referred to at the beginning. So no, you should not smoke your medicine. You should use it different ways. But that is also something that is a widely accepted stigma, that cannabis always needs to be smoked. Endosain, for example, is a finished pharmaceutical. We are in a stage 2 clinical trial investigating cannabis against schizophrenia. So for example, that's also something that's not just hearsay, and it's not just people who want to smoke cannabis who try to get a prescription. It's really science behind it, and there is research that is showing that cannabis can really help much better than, for example, psychopharmaca or other opioids that are actually not good for your health. And on the same areas, cannabis is coming. Then the second part, what we are doing is adult use. So what is adult use? It's the non-medical use of cannabis. So as you probably know, in Germany, on the 1st of April, we changed cannabis law. So it means that cannabis is not classified as a narcotic anymore. And also for recreational usage, Germany loosened up. So Switzerland did the same already 2 years ago. And with Grasshouse Project, for example, we are running a pilot project in Switzerland to basically investigate, together with a research partner, the impact of a cannabis legalization on society. And it will run for 5 years. And after 5 years, we probably know if we believe the cannabis legalization would be good or bad. But exactly the same thing will be starting in Germany, hopefully this year, depending on how fast the government is acting. But next time you're in Basel-Land, Marco, feel free to look at one of our dispensaries. So, and then last but not least, you all probably heard a few years ago about the CBD hype. So that's still something we do. We also believe that cannabis is very interesting for well-being and that it can do a lot of good things. But when we talk about well-being, we only talk about the non-narcotic ingredients of cannabis. So no THC, but rather CBD, CBN, CBG, and other cannabinoids. So here you see very quickly only a few ways of how the products look like. So the pharmaceuticals can be anything between pills, extracts, nose spray, vaginal suppositories, rectal suppositories, really trying to find dosage forms. The recreational products are mainly vapes and flower for the research project. And then for well-being, the normal form of using CBD is basically oils and tinctures. What we do, and what's very important for us, we love the brands that we're creating, and we want to actually create brands that have a lot of love and where we invest a lot of communication. So here, for example, you see Wiz Khalifa. Many of you might have heard about him. He's a very big hip-hop star in the US. He has his own genetics in cannabis, and we are bringing those genetics to Germany and basically will be at the forefront of bringing good genetics from the US to Germany. Secondly, you see here, that's in Basel, our dispensary, where you can actually legally buy cannabis as part of the project. So that's also something we invest a lot of money in. And then last but not least, a new campaign we are starting from the 18th of June onwards, where we talk in out-of-home, TV advertising, print advertising about the stigma of cannabis and why it's good that the stigma is going away. So you can basically scan that in or go on endlich-cannabis.de and you see a lot of famous and non-famous people and testimonials who talk about the positive benefits of cannabis in medical. So what we really try to do is go away from the stigma. You see very clean shops. You see like a very serious campaign about cannabis to make sure that actually cannabis is perceived different in the future. So what's happening with the market right now? 1st of April, Germany legalized recreational cannabis to a certain degree. What many people underestimate that this had a big impact on the medical market because cannabis is not a narcotic anymore. So now doctors can prescribe much more liberal than they did before. And that will lead, depending on the question of a growth, could be 10 times bigger, could be 5 times bigger. But at the end of the day, Germany only has 0.2% of the population being cannabis patients, while, for example, in Australia, we already have 2.5%. So it means that cannabis can help much more people than it is done today in Germany or other European countries. I mentioned that already. So the change of this law has a huge impact on the medical market. And what you see is basically what we are doing, and I'm trying to hurry up now. What we are doing as a business model is we source and curate cannabis from all over the world. We process it, we bring it into 4 different brands, and then we market it to the patients or doctors or pharmacies, depending on who really is your target group. How does it look in numbers? So we are basically seeing a big spike right now. March, the last month before re-regulation, was already like our strongest month. And now since April, you see that the revenue is really doubling, almost tripling, just because more and more doctors are finally basically looking into prescribing cannabis. So what are our biggest opportunities now? And then I'm also done because, as I mentioned, I'm over time. The biggest opportunities today is the growing medical market with reclassification. You saw the numbers. It's really a booming market. 0.2% of the population being patients today. 2.5% is the North Star, which we see in Israel, but also in Australia. The second one is the scientific pilot projects. So similar to what we do in Switzerland right now, we want to do in Germany too, and hopefully in the Netherlands, and hopefully in many more countries who are changing their drug paradigm. And then last but not least, obviously more and more people, more and more countries are changing policy towards cannabis, also in the medical space. So not only international celebrities believe in us, these are all our investors, but also some of the global AAA funds that are on our cap table. And if you want to invest in cannabis or learn more about it, very happy. I'm here for today and tomorrow. So grab me and we can talk over a coffee of the opportunities that the cannabis market is giving you. Thank you very much. And if you want to follow me, you see the numbers here.